Hi, my name is Ben Nelson. I'm 31 years old and I'm applying for the nursing program in the fall of this year, 2019. I've always had a love for the medical profession. I am a licensed EMT since 2007. I was a tutor for the anatomy physiology department in my previous college in Arizona. But the biggest reason I think would be my history in the fire service and how that influenced me to take this step in my life. When I was 18 years old, I worked for Prescott Fire Department. I worked for a specialized group of firefighters called Hot Shots. We mainly did wildfires, and we are the elite of the fire service in that area. In 2013, on June 30th, the crew I worked for, Granite Mountain, burnt over in the tragic Yarnell fire. I remember when that happened, I felt pretty useless. Those were my coworkers and friends. In the next few weeks, I started pondering about that, and I really felt inspired to start a career in the medical service and specifically be a nurse, and even more specifically than that, become a burn nurse. I'm a dedicated individual, and I know that this is a demanding job as well as a demanding program, and because of things I've done in my life, I know that I'll be able to do it. The plan I have in place for the program, I think, would start out primarily with my wife. She has been an awesome resource for me and support, and although there's lots of things that would help me to be successful in this program, having a partner and a support like that is going to be huge. I also have a good job that not only supports me financially, but also supports me in my future goals. They're aware that I want to go into the nursing program, and they actually give me scholarships and support me in various different ways so that this transition can be easier for me and I can be successful. I have obviously done all my prereqs, but on top of that, I've done all the other filler classes that are required throughout the program so that when I go into the program, I can just focus on the core classes. I intentionally did this because I know that how demanding the program can be, and I wanted to be able to focus on one thing and one thing only and be able to not worry about those other things, and so my workload will be a little bit less and I can still live a well-rounded life. And in addition to that, I have done a lot of hard things, and I think that those things will carry over not only in this, but in any endeavor that I seek out in the future. I was a missionary for 2 years, learned a foreign language, lived in a foreign country, learned new things, struggled a lot, and I'm an Eagle Scout. So I don't start things without finishing them. I always make sure that I excel in everything I do and do things to the best of my abilities. Lastly, I think that I would be a good candidate and you should choose me because of my experience in life. Being 31 doesn't necessarily mean that I'm any wiser or more experienced in life. However, I do think that I've accomplished quite a bit in my life. I'm a licensed EMT. I've been an EMT for over 10 years now. I've worked in the fire service. I've been confronted with a lot of difficult situations, not only interpersonal things, but also in the medical area of things, obviously in fire, and all those things have helped me to be able to be more resilient to things that life throws at me. I honestly think that one of the main reasons you should accept me into the program is I think I'm the best. I think that, and I say that as humbly as possible, I think that the things that I've done in my life have prepared me so that I can excel in this next step in my life, and that I can be an excellent nurse, an excellent student, and still be able to do the things that I need to do in my life. And once again, last thing I would say is that, I have shown that I can learn the material. I have taught the material as a tutor, and the fact that I have all my classes done in between all the core classes, then I think that shows that I have a little bit of dedication there and that I'm able to accomplish whatever is thrown at me.